sensory processing disorder and spina bifida. Sensory integration is the organization of sensations for use, providing us with information regarding physical conditions of our body and the environment around us. In sensory processing disorder, the brain has problems receiving and responding to information from the body's senses. This includes taste, tactile, vestibular, visual, hearing, smell, interoception, and proprioception systems. The vestibular system consists of balance and coordination. Proprioception consists of body awareness of where it is in space, and interoception consists of the sense of the internal state of the body. Sensory processing disorder can have various effects such as lack of coordination, disengagement in conversation or play, bumping into objects. When one has sensory processing disorder, a hypo or a hyper response may be seen to sensory stimuli within that individual. Sensory processing disorder can affect children and adults. People with certain diagnoses are at higher risk of having sensory processing disorders, such as those with spina bifida.
Spina bifida is considered a birth defect that occurs when the spinal cord and spine don't form properly. It is characterized by the incompletion of the brain, spinal cord, or meninges. The severity of spina bifida depends upon the type of spina bifida, its location, size, the nerve involved, and the complications. Spina bifida may affect spinal nerves, which may in turn then affect the sensory system. The three subtypes of spina bifida include spina bifida oculata, spina bifida meningocele, and spina bifida myelomeningocele. The most severe type of spina bifida, which will most often be seen with sensory processing disorder, is myelomeningocele. In this type of spina bifida, spinal nerves push through the vertebrae, exposing tissues and nerves.
Some functional problems noted within spina bifida include functional mobility, decreased nerve function for bowel and bladder, skin wounds, poor attention span, eating and sleeping problems, difficulty swallowing, and sleep-disordered breathing such as sleep apnea. Motor planning deficits may be present, particularly for visual perception tasks that require higher levels of motor planning. Additional problems noted in those with spina bifida could include dysmetria, which is a lack of coordination of movement such as undershooting or overshooting, motor learning, dysarthria, which is poor coordination of speech, handwriting difficulties, and self-care tasks.
Some of the key sensory systems affected in spina bifida include the proprioception system, the interoception system, the tactile system, vestibular system, and visual system.
Possible intervention include utilizing the Sensory Integration and Praxis Test, or SIPT, which is a standardized assessment to measure sensory processes and motor planning abilities, detect problems with tactile processing, space perception, or visual motor coordination. Water-based intervention may also be used, which initiates various movements through horizontal and vertical planes. Both active range of motion and passive range of motion may be utilized, and stimulate vestibular system, provide sensory integration, and stimulate the tactile system. Standing balance may be used, which provides exercise such as sorting color blocks while standing by a raised table, and this can be done if the patient's lower spine is affected. Joint compressions may be utilized by the therapist to provide sensory input for proprioception and tactile senses. Creating a bowel or bladder schedule. Visual motor integration, which can include tracing in shaving cream, using letter or number activities, or connecting the dots.
Some precautions to take with one who has spina bifida and sensory processing disorders include having in place a positioning schedule, teaching the individual or caregiver how to perform regular skin checks, watching for signs of overload of the vestibular system, and functional mobility and balance. For more information on sensory processing disorders, you may contact an occupational therapist, read Sensory Integration in the Child, or go to the websites Spina Bifida Association or the Child Mind Institute.